Hey folks, it's Rod with Pow Group. Welcome back on the Pursuit of Wealth. Today is Friday. Happy Friday. It's May 23rd, 2025. And with me today is Paul Duffy. We have CEO of AIML Innovations. They're a healthcare technology company, and they trade on the CSE under ticker symbol AIML and on the OTC under AIMLF. We also are joined by 3D Capital CEO Sheldon Inwentash. Great to have you back on, Sheldon, and nice to meet you, Paul. Great to have you on the show as well.
Great to be here.
Yeah, thanks very much for having us, Rod. It's great to see you.
We'll jump right into it. Paul, maybe if you could just start off, give us a little bit of a background on your professional career leading up to AIML.
Oh, wow. All right. I'll keep it brief.
Sounds good.
I think probably the best way to describe it is I'm a technologist, a serial entrepreneur. I have built, scaled, and sold 4 software companies. The last 2 that I were involved in were public market companies over the last decade. Most people know me as the guy that invented patented holographic telepresence. It's used fairly ubiquitously around the world today. Coming and exiting out of that company in around 2018, I co-founded a company called Nextech 3D AR here in Canada that grew to probably one of the top fastest growing companies in Canada, certainly within the top 20. Experienced a bit of what we call the Zoom bloom, if you would, during COVID. I exited that in 2022. I was the co-founder, president, chairman of the business, and took a little bit of time off, played with some artificial intelligence, and then was approached to come in and help scale AIML Innovations. In other words, look at their core assets, their technologies, and work with a great group of people, really, and begin to build out essentially what would be the next generation of the company. And so I've been doing this now for just about 30 plus years. I love it. It's all I do. It's all I know how to do. And I've got an awful lot of experience, both good and bad, in the scaling and commercialization of companies. How's that for a background?
That's perfect. Thank you very much. Yeah, and if you could just give us a rundown on the company, who is AIML? And a lot of my viewers probably have never heard of the company. I was recently introduced as well. I know 3D Capital has been focusing on the company for a while, and we'll touch on that in a moment. But if you could just give us a background on the company, that'd be great.
Yeah, absolutely. So the company itself is a little over 4 years old. I joined it about 19 months ago, September 23. I came in to essentially really evaluate the strength and power of their neural networks, if you could believe it. We happen to have a very interesting neural net that takes PPG signals and ECG from effectively a watch and allows you to get a medical grade in non-invasive blood pressure estimate, a measurement. And when I got into it and I looked at that business, it became apparent to me that neural nets themselves were going to provide a deep amount of activity around all forms of biometrics, not just blood pressure. And so in the, I think, early part of roughly Q1, Q2 of last year, we acquired a very interesting technology that allowed us to create a robust suite of neural nets around long ECGs. And for your audience, an ECG, EKG, they're somewhat synonymous. It itself is a non-invasive measurement that is typically done by wearing 1, 2, 3, sometimes 12 leads on the body to determine sort of the electrical, capability of the heart. In other words, it allows you to study and understand the heart. You've probably seen ECG waveforms, Holter reports, etc. They're quite abundant. They're literally the most non-invasive diagnostic used on the planet for cardiovascular disease. And ultimately, they've been around now for a little bit over 60 years, and there's been virtually no significant disruption in that market. And so as we were studying what we could do with these new and novel neural nets, it became quite obvious that we could disrupt this global multi-trillion-dollar industry that is essentially utilizing these ECG waveforms to really understand and underpin what was happening to the state of the heart. And just to give you a bit of background, I'm sure your audience, they may or may not know this, but cardiovascular disease is literally the single biggest issue around the global market. From a humanity point of view, 50% of people have some form of cardiovascular disease as they age. In fact, the parties that we deal with, we're coming to learn that much of the cardiovascular disease happens early as you're young, in the pediatric form. Believe it or not, once you've established that, you can actually see where it goes as you get older. There's a lot of factors involved in that, so it comes with a bit of a grain of salt there. But the part of it is nobody's been able to go in and take these very elaborate ECG waveforms and distill them down into a very simple and unified report. To do it today, you have to go to a clinic, you have to wear a device, you have to go through a process from a day to a week to a month to get an ECG recording, put it into a system. It's very complicated. It comes out, and about 6 weeks later, you get a report.
Wow, that's a long time.
and oftentimes there's a percentage, and it depends on which country you're in, but there is a percentage, and it's not small. It's typically 8 to 12% of the people waiting for that Holter report analysis have some form of event, or potentially they die as a result of a heart attack or a cardiac event. And so what we did with our neural net was we ingested that recording, and we figured out how to convert it into a glorified Excel spreadsheet. Take that very complicated waveform that has an entire ecosystem of folks behind it, working to understand it, to read it, to use it to identify anomalies, to determine conditions, and then provide diagnostics, and radically simplify that to the point where we can ingest, we can produce a spreadsheet, and then we can run event analysis on it so that we can provide that back to the cardiologist, to the learned intermediary, and they can make the decision. But instead of waiting weeks, you can do it in minutes. And this has profound effects on all forms of healthcare systems, regardless of the country. It's a global problem dealing with capacity and limitation issues. They're dealing with quality constraints, and they're just dealing with a population bulge that is aging, that is dealing with onsets of cardiovascular disease. So we happen to find that nice sweet spot where these long ECGs, these 24 to 48 hours, sometimes 7 days, sometimes 14 days, can be radically quantified using our technology and delivered in a matter of minutes, as opposed to several weeks to a month or more. And that's what we're basically bringing into the market today.
That's incredible. Yeah, it sounds extremely groundbreaking, and could mean the difference between life or death, right, in certain situations. So, sounds amazing. And Sheldon, maybe if you could just touch on 3D Capital side. Do you own AIML through 3D Capital?
Oh yes, I mean it's one of our key companies, and that's actually why I think it's timely. Its company's been stealth for quite a while, because it's it had to do a lot of development before it could bring it to market, and had to file IP protection and so forth. But what's interesting about this company is it's also dovetailing with the explosion of wearables. And wearable market, through sensors, are going to be able to determine physiological things that are happening that are sort of subliminal in some senses, where there's a lot of things going on underneath the surface that actually contribute to your current state of health. And this company, even though it's chosen to focus on, let's call it the ECG side of things, this could basically go well beyond that because of the ability to determine real signals from noise. So the technicians, in this case cardiologists, can do real interpretations based on the facts in your body, not some interference that's occurring because the transformation of the signal from your body into a wearable, it's not perfect. And therefore, I was speaking to somebody yesterday whose father died on a plane of a heart attack, and they found out that the cardiovascular person that was looking after him misread their ECGs and should have never had him fly on a plane. So a lot of it is because they're guessing based on what they're looking at. And this is almost like the truth machine. So we also believe, so not only the wearable side was a critical contribution to the full service solution that AIML is, but it's also the whole AI side of things. So think about it. We joke that every heartbeat is a constellation of data, but no one has been able to see that constellation because it's been a very cloudy night and they're not sure where there's a star or where it's a reflection of another star or planet, as you know, using that analogy. I haven't used that one before. So what's happening now is every time that they neuralize, they call it an ECG, they put it into the database. Well, you know, it won't take a long period of time that you train your database where if someone has within one heartbeat certain amplitudes and things going on in these waves, that, well, guess what? That's an anomaly that, you know what? In a similar cases, this could lead to an event. So what happens is you get ahead of it, you go to your cardiologist, it suddenly might mean that, you know, you're developing AFib or you've got maybe a stent that, like, there's some kind of issue so that you don't have a sudden heart attack. And also the healthcare system is going to save money that you're not suddenly going into emerge. So there's so many amplification benefits of this technology, but the wearable side, the AI side converge with this, you know, deep algorithm of being able to decipher the true signal from the noise. This is the invention. And we're extremely excited about the potential here because the company's done a lot of research and no one has made this breakthrough.
Yeah, that's a huge use case. So you don't really have any other competitors then, like AIML?
They have the installed base of 60-year-old technology that's basically being disrupted. And the company just announced a number of advisors to its advisory board. And then when you go into the website and so forth, there's quotes. And they consider this the most significant disruption in heart diagnostics in 60 years.
Wow. That's amazing. Absolutely amazing.
We've taken I'll just go a little bit on that, Rod.
Sure.
So we essentially can take in these recordings, which, you know, they can come from actual regulated devices. So things that are FDA, you know, approved. They can come from consumer wearables, you know, and becoming more, you know, more advanced. And we take the signal, we don't actually change the signal, we find the biometric marker and measurement in the noise of the signal. And that is a, you know, small but subtle change. Most organizations that you would think of as competitors actually use what's called noise filtering to extract portions of the signal that remove noise. What happens is that degrades the quality of the signal. Every time you run a filter pass through it, you're getting less and less of the signal, which is the actual biometric measurement.
Okay.
A very perpendicular approach to that and said, no, let's find the signal with the noise, leave it in there. And that was the breakthrough. And to Sheldon's point, we spent probably almost a year in stealth running the IP. There's a very broad, very deep IP strategy and portfolio in and underway, and will probably not abate. It'll just continue to grow. We spent at least the last 6, possibly 9 months working through regulatory. No small course. We've a master file in, we've got submissions in, and that will continue. We have a very big team building not just the technology, but the tools that use the technology for the cardiologists, which will be available shortly. They're looking amazing. And we have stanched the company with a very significant commercialization team. And so all of that happens together and collectively lockstep, the regulatory, the patent, the product development, and the revenue. And we're now coming out through Q2 into our sort of commercialization window, which is quite exciting for us.
Okay, gotcha. Well, appreciate the added color there. And, you know, it's incredible with AI, the breakthroughs that we've been seeing, and it's real. We're just at the forefront of it, right? heard a story that there was a person, I don't want to get into names or anything, but one of their relatives, mother-in-law, had some sort of issue. She wasn't feeling well and couldn't figure out what it was. And they went to the doctor. The doctor couldn't figure it out. So what they did is they went and they had some blood test results done, and they uploaded it to ChatGPT. And ChatGPT was able to determine that it was pancreatic cancer, stage 3. Before the doctors, they didn't even know what it was. So it was basically saying, hey, you need to go get a CAT scan ASAP. And they're like, no, we don't think it's that. And then anyway, lo and behold, they went and got the CAT scan done, and it was stage 3 pancreatic cancer. So pretty incredible to think where we are. And, there's always going to be the doom and gloom side of it as well. But I think it's really going to, like you say, be a profound and disruptive effect on, on humans. And it's going to be amazing, some of the things that we can derive from this.
Well, that actual journey you described, where you would get result, run it through an AI like ChatGPT and get an result, is exactly what we do with ECGs. We quantify, our AI comes back, it provides event detection, so the areas of concern, and it can use those events to form conditions and diagnostics. And the conditions and the diagnostics require the FDA and other certifying bodies to work with, or we provide them directly to the cardiologist, or what they refer to as burned intermediary, and they take the conditions and the diagnostics. And this is, again, it's material because we're able to sell now into environments that are both regulated and non-regulated because we can offer that. And on the gallop of AI in its ability to assist around event detection is incredible and only getting better and better. It's the reinforcement learning that is happening with these systems. It's exponential in its learning ability. And we're just in the beginning of the beginning here.
For sure. And you mentioned, the uprising of wearable tech. You see a lot of accusations and, just basically people saying allegedly it's not very healthy for you to be wearing like a smartwatch all the time. What would you say to those types of people who are worried about wearing this technology?
Oh, I wouldn't worry at all about it. I mean, I think, first of all, there's been no hard evidence that, something like a PPG or an ECG signal is creating any form of concern or, issue. I think the truth of it is the wearable market is going to grow dramatically in the next 5 years. We were with some very substantial partners earlier this week, and we were all talking about the consumer pyramid for wearables, where the very top of that pyramid is in what is referred to as performance athletics. These are the users of these wearables that would gain 80 to 90% of the benefit from the outputs that are being derived from these wearables. So these are your professional athletes, your collegiate athletes, these are, weekend warrior plus type individuals. And when they study who uses wearables, it's that performance athletic peak at the top that is really using all the data to help move their health, for lack of a better term, their performance forward. What ends up happening is that top of the pyramid rationalizes things like ECG, recordings and event detections down into a base commodity for the rest of that market. And really, what does that mean? That market is just under $1.5 trillion and growing. There are 500 to 700 million wearable devices shipping every year. The amount of opportunity that exists to take something like an ECG, a quality medical grade level, and rationalize that into a global consumer offer will happen over the next 12 to 24 months. And we want our technology to be central in that whole story.
And you're not necessarily, dedicated to one particular device or anything, right? You're sort of agnostic to the wearable.
Yeah, that's correct. Yeah, we specifically built our business to be device agnostic, because just like the PDF document can be generated from a variety of different input sources, so can ECG recordings. They can be rationalized into, for lack of a better term, universal file format. We
Right.
ingest that file format and we work our magic on that, which means virtually any device, as long as it has got an ECG sensor on it, is game to utilize our technology. And our technology will always improve the signal quality simply because we find the signal and the noise that they throw away. They figure their signal's too noisy, don't use it. We're the opposite. Give it to us noisy and we'll make sense of it.
That's awesome. Yeah, that's a huge game changer for sure. And what would you say is your biggest challenge with regards to integrating AI into healthcare?
Well, I think what we're experiencing right at the moment, if you were to say mid Q2, calendar Q2 25, is just scale.
Mm-hmm.
We realize, and we know this because we're having these discussions every day, that our product market fit is super tight. Licensing in max yield, the new products that we've got coming out to visualize the outputs, they're all now in discussions around opportunities to close. Now, for us, it's all about the delivery into the segment and scaling the business. So this is a human capital issue. This is nothing more than that. We need more sales bodies. We need more delivery people. We need more product people. We need more of the good problems you want to have as a business. So that's the challenge for us right now. Getting into the market, the way we did that, we have, if you look on our website, you'll see we have a very formidable medical advisory board. Mm-hmm. Very specifically developed our products utilizing this advisory board, and their inputs were critical in the formulation of what we build. So the end result of that is we're able to actually go in. Yeah, if you go under the About Us section on there and scroll down, you'll see a couple of the advisors there. It's pretty good. What ends up happening, Rod, is if we take the technology, we sell it into the market, 9 times out of 10, the problems that companies are dealing with, the parties that are on our medical advisory board have already gone through. And so by them working with us to validate the product market fit, it makes it incredibly easy for us to circumvent a lot of the early discussions that prohibit groups like ours to get into the deal discussions. So we sort of fast track our way into the deal. And that is what's been happening. And that's why we're pretty excited about it. In other words, the technology speaks for itself.
For sure. And you mentioned sales. We'll jump into some quick financial questions. And for investors who are looking under the hood, so to speak, at some of the numbers, relatively small company still, market cap just north of 16 million. I was looking as of the 3 and 9 months ended January 31st, 2025. Sitting at about 1.86 million in cash. You raised just north of $4 million since July 2024. How do you plan, I guess, to allocate these funds to balance sort of R&D, commercialization, and overall growth?
Well, it is pretty much that, right? It's a delicate balance. Mm-hmm. And, you know, what I say to pretty much all shareholders is think about it in the context of, 4 people walking abreast. Up until the end of Q1 2025, the priorities were intellectual property, regulatory pathway, product development, and revenue/commercialization. So think of those 4 activities. As we come into calendar Q2, we basically followed the same 4 horsemen or 4 individuals, but we prioritize revenue and commercialization. Because by the end of our Q1 window, we were far enough into the regulatory, into the patenting, and into products that we were now ready to begin selling. And so the proceed of capital goes essentially across all 4 of those planks. I would say the majority of it. There's a little bit tucked in for other kind of activities, but it's minor. But primarily the revenue is now the cash is now stanced to go against revenue and commercialization opportunities. And so as we come out of Q2, our book is looking good. We will go through Q3 and into calendar Q4 with a wonderful pipeline. We will close business, and we will see traction with our technology.
Perfect. Thank you for that. And for those that are concerned about long-term viability, What sort of strategies do you have in place to reassure investors? I know you had I think it was just north of 2 million for a net loss, and 36.9 million was the accumulated deficit. Could you just touch on that briefly?
For sure. I mean, like all early stage, remember I came in about 18 months, 2 years ago, September 23. We really wanted to build a business that had a platform that once unleashed, once started to sell, could scale very quickly with high margin. And the best way to do that is neural nets, effectively as a service, like software as a service, targeted into very specific biometric measurements that have an impact across virtually every human on the planet. I mean, you can't get a bigger market. And so that is exactly what we've done with the Neural Cloud and Max Yield. We've targeted that ECG diagnostic window for both consumers, so non-regulated, and clinicians, regulated markets. We'll expand the aperture to go beyond ECG. That'll come out as we go through the balance of this year. But just the ECG alone puts us in a great position to drive phenomenal revenues and phenomenal cash flows. What I would look at here is where we're placing the capital that we have currently against the bets that we're involved in. And so for your shareholders and anybody that follows me on this, they know I do things like blitz scaling. I'll use the tortured baseball analogy. We work very closely on a number of grand slam opportunities. These are big deals, company makers, etc. But while we do that, we're working on a series of singles and doubles. These are the smaller deals that we can actually commercialize early paying adopters, early opportunities with. This helps refine the product as we go through that regulatory, through the patenting, and through the product development cycle. We've gone through that, and the singles and doubles are starting to manifest. Once we begin announcing those, I think our shareholders and your audience will start to see the growth curve quite consistently. While we're building that, these grand slams, they start to fold in as sort of additional air cover. And as you come out of the 2025 window, you see we've now got a very viable, robust commercial business that has effectively lifted itself up over the last 24 months with a long arc into the future. I mean, ECGs and cardiovascular disease are not going away. If anything, they're going to become more prolific. In fact, I'll leave it at this. I'll say, and this is just our internal looking at this as we've studied this market, we actually believe that we will be able to monetize over 1 billion ECG recordings over the next decade. And and I think that probably, if anybody looked into this deeply, would realize that that's less than 1% to 2% of the total market aperture over that same decade window. I mean, it's very small. And just once consumer wearables, literally your watches, your rings, your earphones, etc., once they are able to assist with ECG recordings, you'll probably get these things happening at an individual level dozens of times a month, if not dozens of times a day. So it's just I think we're in the right spot at the right time for all of this.
For sure. And would you be able to give a timeline on when you expect the company to achieve profitability?
Profitability is an interesting question there, and I'll explain why. Oftentimes, particularly in the public markets, as we're driving and growing revenue, the question becomes, how much more do we put in to scale the base, the growth? How much more do we put into regulatory, put into patents,
right,
into product development, put into commercialization to feed the revenue? I think, I'd be hesitant. I don't want to, tell me, we'd be profitable in the next 2 quarters, but the company can put itself into the position that if it needed to be profitable, it could within the fiscal year. I would prefer we stay very focused and run quarterly our budgets against literally how the revenue's coming in, what the needs are in regulatory, what the needs are for patenting, and what the needs are for product development. Because it's those 4 elements, those levers, if you would, that really dictate the long-term value of the company.
Yeah. And you're in such a high growth sector as well.
Yeah.
And then in terms of the management discussion and analysis, there was a listed going concern, primarily due to the uncertainty and reliance on equity financing. Is this something that you foresee going away anytime soon, or would the going concern remain for at least the next few quarters?
Well, I think from my perspective, I've never really been concerned about our ability to raise capital. Obviously 3D Capital and our other shareholders, they see what we're doing, where we're going. I can tell you from my seat, I don't lay awake at night worrying about, am I going to be able to, have enough liquidity, enough cash to operate the company. That's not something I stay awake at. What I'm more interested in is, am I getting the highest gain return on the prosecution of the capital that I do have? And, I'm very transparent as a CEO when it comes to operating with our staff and with our shareholders as to where we put our money. Not right a penny, but, the quantums of where the big buckets are. And I think to date, we've been making the right moves. So no, I don't, I understand and appreciate that it needs to be in, those types of disclosures. I think it's appropriate. But as an operating CEO, I don't lay awake worrying about that.
Yeah. That's fair. Yeah. As long as you're not raising money to keep the lights on, I guess is, at the end of the day is the main thing, right?
Our capital is to go across those 4 segments, those 4 planks. And then once you start seeing traction pick up, it just becomes a wonderful virtual cycle.
For sure. And beyond healthcare, is your company looking at other avenues for, artificial intelligence, machine learning applications?
Yeah. I mean, that's a great question. Without a doubt, the core technology could find its way into other, I'll call it markets and segments. It really is one of focus. And, from our perspective at the moment, again, we're focused very deeply around cracking the code to get, for lack of a better term, democratizing the ECG, making it available at a global level at a cost that completely and utterly disrupts the space, but is a good thing for both our shareholders and, quote, for humanity. It's a double win, basically. That same technology can be applied in other segments. And, perhaps at some point in time, we'll see that. But at the moment, no, the focus for us is to go deep and be the sole provider of this technology in the space for ECG. And then we'll open it up to adjacent biomarkers. So we've got multiple signals now coming in. And we'll just continue to grow our box, if you would, from there. But we're not going to go take this tech and now throw it into something that's in a completely different space. Perhaps license it to parties that might want to undertake those ventures. Yeah. But the mind management and capital of AIML will be used to prosecute into healthcare and healthcare alone.
Gotcha. Oh, that's great. Exciting. Well, that's pretty much all I had for today. Was there any parting words that you would like to leave the audience with here today?
Well, I could talk all day for you. Sheldon, do you want to take this there? I can go in.
No, listen, this is a company that, we put at the top of our list at 3D. We have about 60 companies. We think that this is a true foundational innovation, and we believe it's going to save lives, save money for the healthcare system. And I think that the potential is unlimited. So that's why we felt it imperative to bring this company to people's attention. It's early days, but the fact that we're entering commercialization, we're not arm waving that we're developing something and boy, we're going to take on the market. It's already been developed. So, and the fact that the 510K has gone in on the regulatory side is a huge milestone. So I think that the eyeballs on this company are really going to accelerate.
Yeah,
absolutely. Well, I'll be paying attention. I'll be keeping a close eye on the story and hopefully have you on again at some point in the future. Is there a way, is the best way to get in touch with you? Just go to the website, or how can people get in touch with you if they would like to reach out and learn more?
Well, I think, anybody that's interested can reach out via the website. I'm at paul@aiml.health, pretty simple. You can go through Blake if we want to get a bit of a deeper dive and set up a structured meeting from that perspective. And, like we say on our website, every conversation begins with a hello. So, don't be shy. This is the bottom line.
Absolutely. Well, thank you very much for your time, Paul and Sheldon. It was a great conversation, and I look forward to having you on again in the future.
Yeah, thanks for having us.
Thank you, Rod. Have a good afternoon.
All right, take care. Have a great weekend.